This scenario has been developed to complement the educational resource, work-based peer review of clinical supervision practice. You should familiarise yourself with the peer review process by looking through the educational resource and the peer review observation tool before you complete the scenario.
Hi, I'm Penny. As a health professional, I often supervise and teach students and new graduates in my workplace. Over the years, I've attended quite a bit of training in supervision, and I sometimes ask my learners for feedback on my supervision. Recently, I learnt about an alternate way that supervisors can develop more advanced supervision and workplace training skills. This process is called peer review of supervision. What happens is that I, as the supervisor, choose a colleague, a peer, to observe my teaching or supervising. After they have observed my work with the learner, we meet together so that they can give me feedback on what they've observed. So I'm asking you if you'll be my peer and observe this meeting I'm about to have with a learner. I need to give him feedback on his progress midway through this placement. Could you please watch this meeting, observe what I do, focusing on how I give feedback. Make some notes on this peer review tool observation template here, and then you can use this to give me feedback in our post-observation meeting. Thanks for coming to see me. So, we agreed to meet today to go over your midterm feedback. The document here, so after we've gone over it, you'll need to sign it to confirm that you've received feedback. Is that okay?
Yeah, well, that's what I was expecting. I must admit, though, that these kind of conversations are a bit nerve-wracking.
Oh, what do you mean by nerve-wracking?
Well, I've had a situation previously where it didn't go so well in the feedback session.
Oh, that sounds really stressful.
It was, because my supervisor was quite intimidating. And I'd made an unfortunate mistake, which I hadn't picked up on. So it was a very difficult meeting. So now, I'm always feeling a little bit on edge, wondering what I've missed or, what I hadn't done properly.
Well, the way I like to manage these sessions is firstly to collect a bit of 360-degree feedback from the other team members and then add it to my own observations. Then when we meet, I like to listen to your thoughts about aspects of your learning that you think are going well or your challenges. Mm-hmm. Then we go over the form together, set the learning goals for the next couple of weeks. Okay. It's important in these discussions to keep the actual assessment criteria in mind. You'll be familiar with those. The domains are professional behaviour, team interaction, applying knowledge to clinical practice and communication.
Oh, that sounds okay. Yeah.
So keeping those points in mind, what would you like to start talking about?
Well, I had that situation yesterday where I couldn't do what I was hoping to do because they were very upset and couldn't explain to me what was wrong. I felt terrible. I wasn't able to work out what was bothering the patient, so I didn't get to do what I'd hoped to do.
Can you explain to me what you did do?
Well, I had to call one of the other staff members for help who knew the patient very well, and they were able to sort it out for me. But by the time he'd done that, it was time for him to go to physio.
Well, your actions sound quite appropriate to me. Knowing your own limits and using the expertise of your other team members is a really important clinical skill to develop. How did it feel?
Well, good and bad. Good because the patient became more settled and cooperative, so much so that by the time the physio came, he was happy to work with them. But bad because, well, I didn't sort it out myself.
Did the situation make you think of anything you might do differently next time?
Yes, I would definitely have read the recent notes. If I'd done that, I probably would have sorted out what was going on without wasting so much time.
Seems like a perfectly reasonable approach to that problem. Also, the other staff member did talk to me about the situation, and they said that despite struggling with the strong feelings of the patient, that you were really reassuring and appropriate. This is solid development for you, as I've noticed that previously you've been quite focused on your own actions rather than noticing how the patient is responding to you.
Thanks. It's good to hear that I'm improving.
So just watch that you give your patients your full attention, otherwise you can miss really vital clues.
Right.
Now, about the form, have a look at the scores and tell me what your initial thoughts are.
Yeah, well, I think that the low score for applying knowledge to clinical practice is probably fair. I know that I had trouble, especially in the first couple of weeks, to work out how to use what I knew for each patient.
Okay, well, so that's your lowest score. But scores for team interaction and professional behaviour are quite high. Other people in our area have told me that you participate quite well. I've noticed that you're always punctual and you seem to finish your work well by the end of the day.
Well, I have been having a bit of trouble keeping on top of the long list of patients. I mean, the other day I had to ask another staff member for help, otherwise I wouldn't have been out of the door before 6.
Well, getting help from others is a really good strategy. Well done. So overall, I think you're progressing really well. You just need to keep on with your placement. So if you can sign here just to acknowledge that you've received some feedback. Any other questions?
No. Thanks for your time.
This project was funded by Glenarden and Flinders University in the Northern Territory of Australia.